Okay, so that was a quick overview of a project that we were doing in Honiara last year with funding from the Rotarians Against Malaria and WHO. So this was done in partnership with the Honiara City Council. So the challenges that we have at the moment in the Solomon Islands is around data, the timeliness of reporting. So it takes roughly 2 to 3 months before we have data from the situation out in the communities to the people who are making decisions. Yeah? So there's an issue of time. We also currently still have a paper-based system. So we heard before the challenges with that as well. And then the granularity of data, how the scale or the level that data has been able to be zoomed in. So at the moment, we have data down to health zones, but we don't really know within health zones where are specific hotspots. So these were the issues that this project tried to address, and in a sort of a novel way. So using the current paper-based data forms, we digitized it using the tool called Kobo. I think maybe a lot of people in this room have used Kobo before. Then we trained some health workers who were based in health facilities, clinics. So we started off with public health facilities, but then we also got some private health facilities to participate in the program. And they interviewed every positive case, and one of the cool questions was, can you pinpoint your house using basically Google Maps, Google Earth? And there was also an opportunity for counseling with the patients. That is something that's not being done very well in the Solomons. So this was able to give us some real-time malaria data, because as soon as that form was clicked submit, it went to this dashboard that everyone in the national and the Honiara City Malaria Office had access to, and we could see where the cases were coming from in real time. And the other cool thing about this was we were also to have data that was pinpointed to people's houses. And this data was able to support decision makers to make real-time decisions. We did meet weekly, so that was as real-time as we tried to get to. So for example, this is a shot of a street, and you can see the Vivax cases are in blue, and the PF falciparum were in red. We also were doing some dengue cases mapping as well, but it was a very simple tool, and it was pulling out some really useful data. Yeah, so in terms of the outcomes, we were able to provide real-time data that was being used for decision making. We had data that came down to the specific household level. So when we went out in the following week to do our response, we went and visited these houses with people who had malaria the previous week. We did fever testing for the other household members, and we also did IRS spraying in those houses. And yeah, it was the first time that we were also able to collect data from private health facilities who have usually been very hesitant to sort of participate or share their data. And I think it was a testament to the collaborative approach that we took for this. So I guess in summary, if you can get good questions and get good tools, that will help you to create good data. And when you have good data, it'll help you to come up with good responses and good implementation to respond to our vector-borne disease problems. Thank you, Thomas.